cushions, the often forgotten element of a seating assessment. When assessing for a chair, we often concentrate on a client's seat measurements, the depth, the height and the width. However, it's also critical to give the same amount of clinical time and effort to understanding the detailed needs of your client's back cushion requirements. You must have an overview of the client's diagnosis, which may impact posture, for example, weakness to one side, and observe and feel any anatomical changes to the spine so that spinal deformities can be accommodated in the cushion choices, for example, kyphosis. Once you have the relevant information, you can then discuss and recommend options that will meet your client's individual needs now and take into account the changes that the client may have in the future. Why is measuring the seat depth accurately so important? Measuring the seat depth of a chair is critical to enable pelvic stability and good posture. You need to measure from the back of the buttocks to the crease behind the knee or the popliteal fossa. Subtract 25 millimeters to allow for knee space and movement. If not measured accurately, significant problems can occur. If it's too long in depth, the seat cushion will push up against the knee joint, restricting movement and potentially causing rubbing and skin damage. The client will try and avoid this by moving their bottom forward in the chair, and this results in their back not being supported, making it harder for them to engage in activities, and will create a pelvic tilt, increasing the pressure on the ischial tuberosities. If the seat is too short in its depth, the thighs will not be fully supported, which can lead again to increased pressure, instability and discomfort. Pressure cushions, trigger for use. Why is the type of cushion specified so important? All of our clients are different and therefore we need to assess for their individual requirements when it comes to pressure relief. So when do we need to look at cushions that offer greater pressure relief? There are many indicators, but 4 clear triggers are as follows. Number 1, when a client is sitting in a chair for long periods of time. 2, when a client cannot actively reposition themselves to relieve the pressure on their bodies. 3, when there is a high risk of skin breakdown. 4, where there has been a history of pressure sores in the past. 1 or all of the above would suggest that the assessment and cushion specification is needed to reduce potential skin damage. And what do we get wrong? We're all aware of the fact that approximately 20% of weight distribution is through the feet while sitting, and we all know how to measure the height of a chair from the back of the knee or the popliteal fossa to the floor. But is this correct? One of the biggest mistakes we make as occupational therapists is not looking at or discussing with our clients their footwear. We should always complete this measurement with their preferred shoes or slippers. This can make a significant difference in the overall height. If we do not get this measurement correct, we will impact the client's stability, pressure and comfort, and ultimately the usability. So let's look at clinical reasoning for a tilt in space mechanism. The tilt in space movement allows a seat to back angle to remain the same whilst the whole seating system is tilted backwards. Therefore, the angle of the hips, the knees and the ankles are maintained regardless of how much the client or carer changes the chair position. When supporting the clinical reasoning for a tilt in space chair, we should consider the following. It provides for a change in position for clients who cannot independently shift their own body weight. It allows a client to be repositioned to enable them to engage in purposeful and meaningful activity with minimal effort required by the client and the carer. It reduces that shear and friction, which are contributory factors of skin breakdown and the development of pressure sores. And 4, the tilting mechanism can be used as part of the 24-hour pressure management program to change position and